So we're now going to have a look at the peroneal tendons that we know sit on the lateral aspect here of the ankle joint. If we use this model just to showcase the anatomy of what we're looking at, you can see here the distal tip of the lateral malleolus, and the tendons run around this lip here. So they come around the back of the malleolus, which causes us some challenges when it comes to an ultrasound evaluation. They then come down into the foot with brevis attaching onto the base of the fifth here and longus disappearing underneath. And we know that we've got our peroneal tubercle in this region here where those tendons divide. So they're going to come round the back of the malleolus, run round the corner, and then come into the foot. So we've got to be thoughtful of that with our probe in this position as we come round the corner. If we then have a little look with our ultrasound, you're going to need plenty of gel in this area because of the bony anatomy and the prominence of the lateral malleolus. So if we place our probe on, and I like to do this with the patient in supine, I feel like I've got better control of the foot. I can also then control the rear foot here and apply a talar tilt for the Calcaneofibular ligament, which I'll often look at in the same evaluation. So I'm going to place my probe on at this point, ensuring that I know that the left of the screen here for me is going to be anterior and the right of the screen is going to be posterior in this instance, and I immediately can start to see some structures appear. Now we know that this then is the Peroneus longus tendon. Deep to it we have the Peroneus brevis, and then this is the muscle belly, or the distal part of the muscle belly of Peroneus brevis as it comes into its muscular tendinous component distally. As I roll my probe down, you'll then start to see that we end up with two distinct tendons. We have the brevis here and the longus here. Now note how I've started to move my probe around the corner here. You have to just reposition the probe as you come round. You can't come straight down. You need to come round the corner and actually start to tilt your probe. So as we come down, I'm keeping those tendons bright with lots of tilting of the probe. I'm going to run round the corner. Here come the tendons. I'm keeping them beautifully centered here on the screen. I start to, at this point, also see the Calcaneofibular ligament, which runs underneath the peroneal tendons at this point. And at this stage, we can also just apply a very gentle talar tilt to see that ligament become more taut and lift up our longus and brevis on top as if it were a hammock. We can keep coming round the corner, and at this point we see a slight change in the cortex underneath these tendons and slightly anterior, and this is your lateral or anterolateral subtalar joint at this point. And we can see that very clearly here, which is a location that's commonly used for injections. If we come back to the two peroneal tendons, I can then follow them round the corner to the peroneal tubercle. At this point, I want to reduce my depth just to help me see those structures slightly more clearly. We then know that we're going to have longus, usually the larger of the two at this point, which you can see here. It's going to disappear away underneath the sole of the foot, and I can still focus on brevis, which is here, ensuring that I've got enough gel. Here's brevis, and I can follow that all the way down then in short axis onto the base of the fifth. And if I come back round and spin on that structure, we can see it actually attach really beautifully in a long axis view coming onto the base of the fifth here, and you can see the tendon in its entirety coming back across the screen to attach. This is the base of my fifth metatarsal here. If we then follow that back up, we'll start to see the black appearance of the Peroneus longus, which is slightly more plantar, start to come up. That's dark because of the effect of anisotropy, and again I can tilt my probe to try and fill that in. As it then comes up, the two rejoin, they meet up again. We can then follow them back up, and I'm going to reduce my depth at this point, and we can start to follow those two tendons up, back up into that retromalleolar area. Now the other structure that's just nice to have a look at in this area is your peroneal retinaculum, and it often appears as quite a hypoechoic structure. You can see it here quite nicely, has a triangular attachment onto the distal fibula, and you can stress test for instability of the peroneal tendons in this position quite nicely. If I get the patient to resist against me and push out to the side here, working those peroneal tendons, we can see they remain within the tendon area there, within the tendon sheaths. Again, push again against me. You do sometimes see subluxation within the tendons themselves. The brevis may flick around the longus, but in this instance we know that the peroneal retinaculum on top is intact. We can see it very clearly there over the top of those two tendons, the Peroneus longus and Peroneus brevis.